Hello, everyone, and thank you so much for joining us again to listen to our podcast. We really appreciate it. Today, we're going to be discussing inflammation, and with us, we have Dr. Nath, who's a partner with us at Capital Periodontal Group. He has given us a pleasure to give us the time to discuss inflammation. Hello, Dr. Nath. How are you?
Hey, Pedro. I'm Dr. Towfighi. How are you?
I'm doing great. Thank you so much for joining us. Really appreciate taking time.
Thank you for having me.
Absolutely. So we've been discussing periodontal disease, of course, and how inflammation actually contributes to most of the diseases in the world, in our body, and the effect that it has. So I wanted to kind of go through some, and maybe have some discussion about inflammation and how it's involved.
Perfect. Well, first let's start off talking about basic inflammation, right? What causes it and how your body reacts to it. So say you're walking down the street, you trip, stub your toe on this sidewalk. What happens? The first thing you notice is that you have pain. And then you have some swelling and heat to the area. That's because right when you initially have an injury, the first thing the body does is increase the blood flow to the area. This causes the reaction of, the first thing you feel is warmth and swelling, because that's what you want. You want your natural body's defenses to kick into high gear and say, hey, we need extra cells, extra nutrients, get the guys that need to be there to help solve the issue of the start the cascade of the inflammation. So when the inflammation occurs, your body is sending more cells to the area, and your body has specialized cells. Certain types of them release things called cytokines, which release chemicals which can slow down the invading bacteria, if it's a virus, say, or if it's an injury, cause the correct cells to be released to increase the natural healing ability of the body. And that's the initial cascade. That's the initial signs of inflammation. It's usually from a trauma, whether that be a virus or bacteria invading the body, or something like bruising your arm or your toe from a trip and fall.
So overall, inflammation isn't really bad. Then why are we so concerned about inflammation? When does it become bad?
Yeah, exactly. So inflammation is, your body needs it. It's the first step in healing. However, what happens in situations, just like anything else, it gets out of control. It doesn't know when to turn off. And when you have this inflammation that's chronic, that means it's lasting more than a week or 2 weeks after the normal healing should have occurred. You get a chronic level of inflammation, whether this be high or low. It's almost like your body's running at temperature for a long time. You can imagine how that would wear you down.
Yes.
The same thing's happening in your body. When you have a low level of inflammation, whether it be from periodontal disease or heart disease, these inflammatory cells cause other problems in distant locations from where the primary inflammation occurred. These long-standing inflammatory mediators, cells releasing different proteins and cytokines, cause the chronic inflammation, which has been associated with so many diseases that we know of now. They found
including periodontal disease.
Including periodontal disease.
Absolutely.
They find it in diabetes, heart disease, strokes, and we'll get into that a little bit later. There's some really interesting studies that have come to light lately.
So what can we do to decrease chronic inflammation?
Yeah, the problem is, like you said, is chronic inflammation is not this short-term inflammation called acute inflammation. A lot of the things are basic common sense, things that your doctors have been telling you for years. Get plenty of sleep, don't live a sedentary lifestyle, get up, get movement, get some exercise in every day. Do your medical checkups and dental checkups. Get your teeth cleaned. We're talking about dentistry today, so that's going to be the focus on.
Exactly right.
But showing up to the dentist, getting your teeth cleaned, going to the periodontist, staying on periodontal maintenance if you need such things, to keep down the inflammation, primarily by removing what's causing the inflammation, which is the bacteria.
Okay, so I've heard a lot about taking certain medication, supplements, even NSAIDs, which are anti-inflammatory medications. Why don't we just take that and take care of everything?
Right. Yeah, you would think that NSAID, non-steroidal anti-inflammatory, it's right there in the name. The problem with these medications is that they're short-term, right? If you think of inflammation as a river, they have little tributaries and streams that run off.
Yes.
NSAIDs affect one part of that stream. It's shutting off some of the pain receptors, some of the inflammatory receptors. But you still have that river going downstream, causing the inflammation. You know, there's other things that you can take as well as a healthy lifestyle, which I'm a big proponent of, like omega-3 fatty acids.
I know that.
Omega-3 fatty acids. Fish oils have shown to decrease inflammation to a certain point.
Yes.
However, currently, there is no magic bullet. There's no medication on the market to really address chronic low levels of inflammation, and that's really what's causing the problems. It's not the acute. It's, like I said, when it gets out of control and stays for longer than it should. It's like an uninvited house guest.
Very good, very good. So we know acute inflammation is actually good because that's kind of a warning sign for the body, but chronic inflammation is bad. But of course, we're dentists, and we specialize in gum. So let's talk about that. Let's talk about what happens when we have periodontal disease, how the inflammation contributes to that, and what are the effects of having chronic periodontal disease.
Exactly. So, when you brush and floss, you notice some bleeding on your floss on occasion. If that goes on for a long period of time, the inflammation is a result of the problem. The problem is the bacteria on your gums. How your body responds is an inflammatory response. This inflammation, this means this bacteria is now able to get into your bloodstream because inflammation, the bleeding gums, bacteria goes through where the bleeding occurs into your bloodstream and can be found in faraway targets. There's a lot of research showing one of the bacteria is, not to get too sciencey, but P. gingivalis and Alzheimer's disease.
There was a recent article about that. Is that correct?
Yeah, it was done by UCSF. In a recent article published by University of California, San Francisco's dental department, they did autopsies on people that had deceased from Alzheimer's disease, and they found the same bacteria, P. gingivalis, which is the cause of periodontal disease in many patients. They found these in the plaques in their brains and in distant tissues. So we know that bacteria is getting in the bloodstream, coming from the mouth, and arriving at distant areas.
Sorry to interrupt you there. So basically, you're saying when somebody flosses their teeth or brushes and have a little bleeding, they have opened up a port, which is their plumbing in the system, all the blood vessels, and with that, all the bacteria in the mouth can actually travel throughout their body and end up in the brain or the heart and everywhere else.
Even on joints. A lot of times after you get a knee replacement or a hip replacement, before you go in for more invasive treatments, you have to take prophylactic antibiotics because they know the bacteria in your mouth can travel in the blood system once it gets disturbed and end up on these joints and artificial valves, cause inflammation, cause an infection in those areas. And you can it's the same bacteria that they find on these joints that have to get taken out again on occasion that come from from your mouth.
From your mouth, exactly. Yeah. Very good, very good. Okay, so somebody goes and sees a dentist and they tell him, your disease is caused by bacteria, but we're talking about inflammation. Could you just go over that a little bit with me?
Yeah, exactly. So bacteria is a culprit, but more or less it's how your body responds to the bacteria. The bacteria, just like your body, releases cytokines, certain cells. However, these cells in your body elicit the immune response, elicit an inflammatory response. And the interesting thing is different people's bodies react differently to the same bacteria. It's called the host response. Each time your body is challenged by bacteria, it can change and act differently. And that first change can change it for a long time. It's called the host response.
Okay.
And this inflammatory response is a result of the bacteria, and it's a result of how your body reacts to that bacteria. That's why some people, God bless them, can get away with flossing once every other day. Other people can be as diligent as they want, and they still have periodontal disease and still have this inflammation and break down. It's not necessarily that they're not doing a good job of cleaning their teeth. It's how their body's responding to the bacteria they have present inside.
Okay, so you're saying that everybody's different as far as how they respond to the bacteria in their mouths, and it could be a genetic thing, for example. Absolutely. Okay, so you're saying that what happens that once the bacteria gets in, the toxin from the bacteria actually irritates the gum. So body's trying to fight all these bacteria, and of course all the fighting's happening within the gum tissue, and because of that, the outcome is losing bone and gum, and eventually having tooth loss, basically because of it. That's what we're talking about.
Absolutely. Unfortunately, the bone's the innocent bystander, and he's holding on to his buddy, the tooth, right?
Yes, exactly right. So, of course, as you know, we in the practice, we have, some people that come in their 80s and hardly have any bone loss and hardly ever clean their teeth, and everything looks beautiful. But we also have 20-year-olds that come in, and they're probably not going to have their teeth by the time they're 40. So their response of their body is so aggressive that actually makes them respond differently and, of course, lose more bone.
Absolutely. So your body can actually overreact to the situation, and that's what the chronic inflammatory state is. It's an overreaction to a stimulus that triggered it.
Okay, so I'm a patient. I go into a dental office. What do they do? What do they do from beginning to end to figure out that I actually have gum disease? And what are the different levels of disease? And how do they measure this?
Absolutely. So the first thing you do when you go to a dentist's office is you get X-rays, right?
Yes.
This is a nice picture showing you where your bone and your tooth, and not necessarily where your gums are. Sometimes they'll show up a little bit, but you get an idea of where the bone level is in your mouth.
Yes.
They also do the periodontal charting. Everyone's heard it, right? 323, 323.
I thought there were a lot of numbers.
Yeah,
Oh,
I wish,
okay.
right?
Yeah.
But what they're doing is actually measuring the level of the gums to the bone, and they're also looking at inflammation. So when those numbers get beyond 5, that's when we start to worry that we're starting to lose the supporting bone holding your teeth in, and that's when, the level of care needs to be ramped up. You're beyond normal cleaning by that point. And, you may need scaling and root planing, which is a deep cleaning, or possibly periodontal surgery, depending on how much inflammation you have. And the inflammation is considered bleeding on probing. That's the term we use, BOP.
Right.
And so you're looking at for bone loss that you can collaborate with the x-rays as well as bleeding on probing. The bleeding on probing shows you that there's inflammation going on and potentially breakdown of the gums and bone.
And the bone around the teeth. So basically, that little pointy thing or the sharp thing they kind of poke into people's gums, and it has a ruler, is basically what we're talking about, a probe.
Absolutely.
So it has different numbers, kind of markings on there. So as they go deeper, so the deeper it goes, the bigger the number it shows, then it shows that actually they have gum disease.
Yeah,
and of course, you're saying that, so if I have a 6 millimeter pocket and it's actually bleeding as well, that's actually a different indicator of there's actually more inflammation. Because you could have a pocket that doesn't bleed, right?
Absolutely.
So the deeper the pocket and it bleeds, it means
we got to do something about it.
You got to do something about it. Okay. Okay, so when I go get my cleanings done, I do notice they, like you said, they have this little ruler, tiny ruler that kind of pokes through my gum line, and they tell me to give me all these
fancy
numbers.
Word's a probe.
Exactly right. So the name is a probe. So it has markings on there, and basically what they do is put that between the gum and the tooth, and they go inside, and according to the depth of that pocket, they'll be able to determine whether you have gum disease. And of course, there's bleeding on top of that. So if you have a deep pocket like a 6 or a 7 and also bleeds, that means you potentially have active disease going on.
Absolutely. And that's really the key there, is the active disease.
Yes.
Because that's what we're looking for, is inflammation, the inflammatory response. That's showing us that there is bleeding caused by the bacteria in your body's response to it. So what really matters is not just the pocket depth, but the pocket depth and the amount of inflammation. A lot of times after you go through treatment, you may still have a 4 or 5 millimeter pocket depth. But after treatment, if there's no inflammation, that's a sign of health.
Very good. Very good. So it's basically, you could still have a little bit of a deeper pocket, maybe 4 or 5, but as long as the gums are healthy and there's no bleeding, you could maintain that for a long time.
Absolutely. It's all about access to cleansability.
Very good.
Right? That's why you go into your dentist for routine cleanings after treatment, because there's simply areas that you can't get to with your toothbrush or floss, and that's where a dental team, dental hygienist, comes into play to get in those little bit deeper areas and keep the inflammation down.
That's actually a good point that you brought up, because of course, our listeners, they need to understand how far can you really go down into those pockets between the teeth and the gum and be able to thoroughly clean those areas. Of course, if you have a 9 or 10 millimeter probing number, I would think it's much difficult to go in versus if you have a 3 millimeter pocket, which is health, basically. Is that correct?
Absolutely. The deeper the pocket, the harder it is to clean. That's why sometimes surgical intervention is necessary, whether that be with a laser or a scalpel, depending on what is needed for your case.
For your case, I see. Very good. Okay, so we found out that if X-rays are taken, there's measurements being done by the probe, which gives you, and of course we look at clinical signs to see what's happening to be able to determine if somebody has gum disease. And of course, then you said that the first thing they'll do is go through some potentially deep cleaning, which means if you have deeper pockets, they'll go in there deeper to clean things out. And of course, I'm sure that requires some kind of anesthesia so the patients are comfortable. Okay, so I'm a patient. I go in the dental office and they tell me, you have periodontal disease. You have chronic periodontal disease. And they measure my pockets. They're running 4 5s, a few 6s here and there, basically, and they're bleeding. And they tell me, now you need to go through have deep cleaning. So what should the patient expect when you go through a deep cleaning process?
Yeah, absolutely. So the first thing you should expect is that your teeth are going to get cleaned, right? That's what you're there for.
That's very good.
Many of the times when the pockets are deeper, the inflammation, as we said, inflammation causes pain, right? So a lot of times they'll get you numb for these procedure. A little bit of anesthetic locally in the area goes a long way. And then what generally the hygienist will do at this appointment, sometimes the dentist, will go in, use special instruments called scalers. They have kind of different angles on them to get into all the nooks and crannies of the teeth. The teeth have a lot of three-dimensional anatomy. They're kind of like little caves down there. And they go in there and they scrape off this hardened, called tartar calculus, which is hardened, mineralized plaque deposits on the teeth that get on there almost like small pieces of cement. So what they do with these scalers, these instruments, is they go and scrape off the bacteria and the hardened calculus off the teeth and try to get them back to their original state.
Yes. Very good. So that's it. So I'll go and have my deep cleaning done. Everything's good. So I'm done. I don't have to worry about gum disease anymore. Is that correct?
Right. That's what we all wish it was that simple. However, we always recommend following up. So you get that initial deep cleaning, scaling and root planing, sometimes called, and then you go back a month or two later and they reevaluate the area. At this appointment, they're most likely going to reprobe the area or the deeper pockets that they found, those deeper crevices, and see are they feeling with their probe that we discussed, are they feeling the calculus underneath the gum line? Or are you still having pocketing with bleeding in that area? What this tells us is there's something left down there. And the reason for this is, a lot of times they'll be like, I just had a deep cleaning. Why am I still having these issues, right?
Yes.
There's a limit to the extent that these surgical scalers, the curettes that we were talking about, can reach. Because you've got to realize this is a blinded procedure. That means they're going underneath your gums and hoping they can remove all of the bacteria down there.
Yes, it is true because, of course, it is blind. Patients numb, you don't feel anything. But, of course, it's basically a tactile way of these, any hygienist or the dentist to go in there and clean all these bacteria off the root surface. So there is a chance that we could actually miss those spots, especially if the pockets are deeper.
Oh, quite possibly. All the research shows that a pocket of 5 or more, most of the time, bacteria is being left below there. No matter how good the hygienist or dentist is, it's just a limit of the instruments.
Very good. So this actually tells us that deep cleaning, or what we call root planing, is limited. So if you have very, very deep pockets, those areas probably are not going to respond. But shallower pockets, like maybe 4s, sometimes 5s, they should really respond well. Okay, so I've had that done. So I'll come back. You check me again, and looks like the pockets have reduced in most of the areas. But I do have still a few 6s and 7s. They're still bleeding. You may feel or you may not feel some calculus down there. So what's next for me? When you said surgical care, what does that mean? Because we don't want to scare our listeners there, but we want to also understand that maybe that is the only way for us to be able to get rid of this chronic inflammation, to get the whole mouth healthy.
Absolutely. So the next step is you kind of have to get a more advanced procedure. Generally, the term for this is periodontal surgery. And surgery is done in different ways now. We can use lasers in certain circumstances. With the advent of the laser, a lot of times we don't have to use a scalpel and use sutures. However, there is other times where conventional periodontal surgery is necessary. And I don't want the word surgery to scare you.
Yes.
This is a small incision along the gums, and we reflect the gums off the bone a little bit so we can access the deeper areas of where these pockets are. It's really to make it easier to clean, really, because we already know somebody went in there with their instruments and tried to clean out these areas, but they're just going to get deep enough. With the surgical treatment, we can go in there, add bone grafting material if we need, remove the calculus because we can visualize it, reshape the bone a little bit to get a better contour to allow for a better maintenance, to allow you to be able to clean it. That's really the goal, is by having access to clean these areas, we can decrease the amount of inflammation, decrease the further breakdown, and keep you in a healthy smile.
Yeah, smile. Very good. And of course, you mentioned laser, and I know laser treatments, of course, it still will give us the similar results, but it's less invasive and less pain. Could you go over that a little bit with the listeners as well?
Yeah, absolutely. So there's a myriad of different lasers on the market, and each laser is a different tool and does a different job. The laser that we're primarily using for periodontal disease is it's an Nd:YAG. It's called a Millennium laser. This specific laser targets with its wavelength the bacteria that's causing the problem. It does this by we insert this fine fiber optic tip between the gums and the bone, just like a probe would be, and the laser goes in there and kills the bacteria almost
instantaneously.
Pulverizes
Yes.
it. And the benefit to this is you don't have any sutures. There's much less pain involved in these procedures, and it allows for healing to occur naturally. It's using your body's. It's almost like resetting your body's natural defense system. It's getting rid of that chronic inflammation, letting it be acute, and letting the body get back under control of the situation.
Yeah, and I do agree with you because we find that to be very advantageous now. And of course, the conventional way of doing treatment was exactly what you explained, moving the gums away from the teeth and cleaning thoroughly because you have access now. But with the advent of laser and the combination of both, we can do both and have less number of sutures in the mouth, much less pain, patients are happier, and still get the same results that we always expect.
Yes, absolutely. I think that's the ticket there is a combination of the modern technology with the tried and true methods that we know work.
Very good.
A lot of patients in the front of your mouth, laser is the way to go. Nobody wants the recession.
Yes.
But in the back, if you have better access to clean it, that's the way to go.
That's the way to go. Well, thank you so much for coming in and going over all the information about inflammation. Hopefully our listeners can better understand what inflammation means now and the effect that it has on the whole body, and of course how it starts in the mouth, because of course the intent of this podcast is to say healthy mouth, healthy body. Well, thank you, Dr. Nath, for taking the time to come and discuss inflammation with our listeners.
Absolutely.
I'm sure they have
Had
a
a great
better
time.
understanding what it means now. And thank you so much for listening. We really appreciate taking the time to listen to our podcast. And
Yeah, thanks for having me.
no problem at all.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.